My name is Lighton Lanjuan. I'm going to be performing attitude assessments. And firstly, I'm going to perform under hygiene, provide privacy for my patients, and I'll be going to my patient's room. Good afternoon. Can you confirm your name and date of birth for me?
My name is Ifeoluwa. I was born November 13, 2004.
Okay. So, Lighton, I'm going to be performing attitude assessments for you. Is that okay? Do I have a consent?
Yes.
Okay, so um, firstly, I'm going to for separation check my patient is responding, is alert and oriented. Can you tell me where you are right now?
I'm in the room.
Okay, who is the president of the country right now?
Joe Biden.
Okay, so my patient is alert and oriented times 4. So firstly, I'm going to check my patient is well groomed, is alert and oriented, is responding to me. So I'm going to be performing head to toe assessment. I'm going to be touching you. It's going to be from head to toe. So I'm going to start my assessment, okay? So firstly, I'm going to be assessing my patient's head. I'm going to make sure there is no any scarcity of hair and his ear is well groomed. Your ear looks nice, by the way. And also, so I'm going to be assessing your ears. I'm going to be checking for the ear canal, and there's no any fluid. So no fluid in the ear canal, and the tympanic membrane is good. So I'm going to be touching your face, okay? There's no any deformities, and I'm going to check your sinus. Okay, do you feel any pain?
No.
Okay, and also I'm going to be checking your eyes, okay? Okay, so the pupil is round and reactive to light and accommodating. Okay, can you touch one side of your nose? Wait, are you able to breathe through?
Yes.
Okay, and the other side? So the nose is patent. Okay, I'm going to be assessing your nose, okay? So nose is pink and moist, and also when I check the eye, I'm going to check the eyes one more time. So the conjunctiva and the iris are pink and moist. Okay, so next, okay, one more time, I'm going to touch your face. Are you able to feel my touch?
Yes.
Okay, so patient's lips is pink and moist, and I'm going to be accessing the patient's mouth, the tongue, and the teeth. Can you open your mouth for me? Okay, can you pull out your tongue? Okay, so the patient's uvula is pink and moist. The dentition is good. Tongue is good. Can you smile for me? Nice. Okay, so I assess the face. So I'm going to the patient's face is symmetrical. The nose is symmetrical. There is no any deformity, and there is no any fluid in the ears or in the nose, and the nose is patent. Okay, so next step, I'm going to be assessing your neck. Okay, so I'm going to check for lymph node and assess my patient thyroid. Okay, and I'm going to be palpating the jugular vein. Okay, and so I assess the throat, thyroid, and the jugular vein is good also. So next, I'm going to be performing the chest. Okay, but before I go to your chest, can you rotate your head for me? Nice. So the patient is able to move his head. So I'm going to go to the chest. So now my patient's heart rate is breathing normal, and the chest is symmetrical. My patient is not using any accessory muscle to breathe. Any difficulty breathing? Any shortness of breath? Okay. going to be assessing your lungs, so I just assess the abs. You can breathe in, breathe out. One more time. Breathe out. Breathe out. One more time. Breathe out. One more time. Breathe out. So my patient's lungs is clear. There is no any abnormal sound, and heart is also clear. There is no any abnormal sound. So in the meantime, and okay. So I made a mistake. I should have worn my glove before I start assessing my patients. So if it was to be in a real life scenario, I'm going to make sure I wear my glove first after hand hygiene and starting assessment. So I'm going to check my patient's vital signs and heart rate, blood pressure, pulse, temperature, they're all normal. And now I'm going to be assessing my patient's pulse. Okay, so can you, and I'm going to be okay. So pulse is good, and also capillary refill is less than 3 seconds. Okay, I'm going to assess for your dorsalis pedis for the feet, and it's good. And I'm going to assess for capillary refill, which is also less than 3 seconds. Okay, so I'm going to, at the same time, I'm going to assess my patient's skin. There's no any tissue breakdown. My patient is dry and there's no any abnormal color. So since I'm done with that, I'm going to assess my patient's abdomen. And after, I'm going to palpate. Do you feel any pain? Any pain? When was your last bowel movement?
2 days ago.
Okay, so all right. Do you have any constipation? Any nausea, any vomiting? Okay. All right. So I assess my patient's abdomen, and also I'm going to check the skin. Also, there's no any breakdown tissue. And now I will go to the neuro and muscular. Okay. So, and also I assess my patient's leg. There's no any tissue breakdown. So I'm going to be assessing your neuro and your muscular. Okay. And okay, can you pull your hands up for me? So I'm going to pull you, but let me pull you. Okay. Nice. Okay. I want you to straighten your hand and rotate for me. Okay. So my patient's range of motion is good, and also muscular strength. Okay. Can you flex your ankles for me? Nice. Okay. So push down on my hand. Okay. Nice. So can you straighten out your leg for me, bend it, and the other one, nice and bend. Okay, so my patient's ankles and knees range of motion is intact, and muscular strength is good also. So I want you to take a little step forward for me. I'm going to be assessing my patient's gait. Just a little step forward and backward. And you can turn around. You can take a seat. So my patient's gait is good and steady. And if I'm to use the Glasgow, I'm going to be rating my patient 15 because it's a Latin oriented, and he has a range of motion and muscular strength. And so okay, so I'm going to perform patient's education due to the hot weather. Try to make sure you stay hydrated. Do you have any question for me? All right. So this, are you comfortable?
Yes.
All right. So I'm going to discard my gloves and perform hand hygiene, and I'm going to document my findings.